Hello and welcome back to OCD Coded. I am Erin Brown, a licensed marriage and family therapist and mental health counselor, and I'm here to help you decode your OCD and learn how to turn it into a superpower. I am also diagnosed with OCD and was not until later in my life and want to really, I found it really being misunderstood a lot and feeling really just misunderstood and isolated. And I really hope to help other people who may feel that way to learn how to really use their OCD as a superpower. So today we're going to be talking about OCD and trauma, kind of the differences between them, how to tell that difference, what to do about it, and a little intro into all of those. So the definition of trauma that I find the most helpful is being powerless in a life or death situation, and how much that powerlessness is what is so hard. And that with a life or death situation, it can be many different things. It can be witnessing one, it can be going through one, and especially for children like, a life or death situation can be if your parent isn't able to be emotionally available for whatever reason. And so it's knowing that this trauma can come in a lot of different forms, and that powerlessness is incredibly scary, and it's one of those unknowns. And so while trauma can lead to a lot of fears and flashbacks and nightmares and those kind of things, which are very usually focused on the traumatic event. OCD, you can develop OCD after having a trauma, and you can also have OCD before having a trauma, and then, have both. And so one of the things about it is they're both treated very much the same way. You know, how OCD is talked about as a fear-based disease, and that PTSD or trauma is very much about fear. And it's just fear of a more specific event, um, or events or feeling. And that was like, what is the obsession about? And with EMDR, which is eye movement desensitization and reprocessing, it's one of the things that I specialize in, and that really has helped with trauma. But that also, beyond that, there it's coming to see more and more that it helps with not just trauma, while also so much there is, that trauma happens in so many different forms, but that also with anxiety or depression and processing disorders like OCD. And that with how that helps is because that the way EMDR was taught to me was about that the messages that are internalized because of trauma. And so how to focus on, and that common ones can be, I'm not good enough, or it's my fault, or I'm unlovable, and how those can get buried under a lot of different other things because they're so painful to think about. And but we really tend to still believe them. And then with OCD or trauma, can part of it can be the obsession or the fear that those things are true, and then the compulsion to see if they are not. And that so much of what we're trying to do with all of this is replace that message that you have about yourself, and to change it into something you really want it to be. And that is part of how we learn to actually, love ourselves, and how to do it kind of step by step. I remember being really frustrated by all that, before. I think, that message from that to love yourself is comes from everywhere, and it is a good message. And I was noticing that there were a lot of it comes from a lot of different places. It's in a lot of different, it doesn't matter if it's religion or philosophy or self-help, kind of whatever genre, that loving yourself is one of those top things, but no one never seemed to really say how to do that. And that was always really frustrating to me. It's like, okay, great, love myself. How? And that was something that I felt like I had to stumble and bumble my way through. And that, that like that's part of what I'm trying to develop here, and part of what my course is about with how to turn OCD into a superpower is to actually teach you those steps to learn how to love yourself, and what to actually do and what that actually looks like. And that's, when with the whole self-forgiveness thing, and how important that piece is, and then how to actually do that. Because again, it's like, okay, great, forgive myself. Now what? And so it's just really noticing that trauma and OCD are very similar, and how it may or may not be part of how to, um, be able to like, but the way that approaching them is the same no matter whichever one it is. And that you are not alone with this, that like that the obsession again is the fears, whatever the person is afraid of is replaying again and again. And then that compulsion is to reduce that distress of the unknown and to reduce that, pain that it seems to feel about it. And with OCD and trauma, that powerlessness is such a huge part of it. And how we address that powerlessness differently is a big part of what the treatment about it all is about, is, that like how do we do that? How do we find that? And how do we find, acceptance or those kind of things without it being like we're giving up. And one of the things I like to talk with clients about is how to like that acceptance isn't like sinking to the bottom of the river, being like, I live here now. It's learning to float on the waves. And that, that all of these concepts and how they come together, but then how OCD makes it so difficult to be able to do that, to release. And there are some great research out there about that people with processing disorders and with OCD, there's a heightened sense of empathy. And so it is feeling more deeply for other people, but then there also comes with that a feeling of responsibility for that, for, the person or the feelings or, and it comes from a good place, but it can feel like too much responsibility that it ends up coming off as like you have to be okay so I can be okay, or different ways that other people may experience that OCD or call it controlling, when it's not that the person is controlling, it's the fear that's controlling the person with OCD. And we're learning and trying to learn how to empower and take your power back from there. And that it is, it can be a quicker process than it seems like. It doesn't have to be a slog, but that, it's also not going to happen overnight. And that practice is such an important piece of it, but that, we're really how to be able to love ourselves and love on other people without feeling this responsibility for other people's feelings. And that was the difference between compassion and empathy. Compassion is being able to care about someone's suffering without, but without feeling it, where empathy is feeling their pain and then usually feeling responsible for it. And so again, with people with OCD having heightened empathy, but can also struggle to process that empathy. And that's such a big thing with so many processing disorders, is it's not that there is not empathy, though that's what it can look like if it gets to such a heightened spot, because they're having such a struggle to process their empathy that that is what is getting in the way of them being able to interact with other people and to be perceived this other way than they're really intending, either to be perceived as controlling or to be perceived as not caring, are common ways that people with OCD are perceived that are inaccurate, but that it comes from this incredibly deep empathy and then a struggle to process that. And, and there's not just empathy that they feel deeply, it's all, or we feel deeply, that it's all feelings and how hard that is. And so then it's like, okay, I know how bad this hurts and I want to help you not feel this bad, is where the kind of common thinking behind it with OCD, but that is not maybe how the other people are experiencing is part of it, as well as that like that is what we're really focusing on with all of this and with the course and the different things that I really want to help people with, is how to process that empathy and how to realize that feeling deeply is a superpower. And part of OCD is one of the many tools in the tool belt of OCD that can be one of your superpower kind of things. So I hope that was helpful. Please let me know if you have any questions or comments. I'd love to hear from you, or anything that you're interested in hearing more about as we learn and practice just walking towards ourselves in this way. So I hope to continue this walk with you, and I hope you have a great week. Talk to you next time. Bye.